Stephanie Smith. I'm with Senior Advocate, and this is our series called Doc Talk, and it's with CenterWell Senior Primary Care. They have offices throughout Virginia, and they are looking to open some more. So if you're interested, you can check to see if they have one in your area. We are going to be joined today by Dr. Banerjee, who is in the Richmond location. And I just wanted to tell you a little bit about her background so that you know who is speaking to us today and kind of what she has done in her past. Dr. Banerjee joined CenterWell as a board-certified family medicine doctor. She completed her residency at Texas Tech Health Science Center in Amarillo, Texas, and she earned her medical degree in medical school in Burdwan, India. Before joining CenterWell in 2023, she co-founded Apex MD and the Apex Holistic Wellness Center, serving as their medical director for 13 years. A pioneer of integrative medicine in Richmond, Virginia, she teaches patients health principles and personal transformation through diet, behavior, and stress changes. Integrating family medicine with an expertise in nutrition, autoimmune disease, and endocrinology, she creates an integrated health plan for the whole person. Her care philosophy has been shaped by working with older adults, and it also is one that resonates with the CenterWell Senior Primary Care values. Dr. Banerjee chose medicine to enhance lives and actively participates in nurse practitioner training. In her free time, she enjoys gathering with her family, painting, and reading. And so thank you so much again, Dr. Banerjee, for joining us today. This is going to be a great presentation. What we're going to do, everybody, is we will take questions in the comment section. If you don't know how to do that, you can just scroll down to the bottom of your screen and you'll see a chat button and you can put your questions there. If you don't quite know how to do that, if you're on a phone, sometimes it's a little bit more difficult. You can also text my number, 757-645-6364 with any questions, and then Dr. Banerjee will answer them at the very end of the presentation. So we are ready to hear and learn.
Okay. Thank you, Stephanie, for the introduction, and thank you everyone who is here. I'm very excited to talk about this topic, dementia prevention. So dementia prevention. So let me go to the next slide. Oh my God.
Nope.
Am I stuck here? Okay.
There we go.
So our brain is just incredible. It's a bank for memories. So we don't know the value until we see someone in front of us having problem with memories. So it controls our movement, it controls emotions, and it stores our precious memories. So there are some facts of dementia that I would like to say, but before that, let me just give the actual definition of dementia. Dementia, in a simple term, dementia is actually it's not a specific term, it's a general term. And a general term to remember like impairment. I would use the word impairment to remember things, impairment to make decisions, impairment to make judgments in doing everyday's activities. Whereas a normal aging does not include impairment in judgment or impairment in doing things on a daily basis. Normal aging is could be as weak muscles, weak bone, stiffness of the arteries, stiffness of the vessels, and there may be some memory changes. And the memory changes could be, say, I lost my key and I'm not being able to find it, but maybe after half an hour I found my key. That can happen, not all the time, once in a while. Struggling to find words, and then I would remember the word later on. Forgetting the name of an acquaintance or forgetting the name of a recent event or who was the actor in that movie, those little things is pretty acceptable and it does not interfere our daily activities. But the rest of the things stays same. So now the question is, is everyone who is getting old would have dementia? The answer is no. So that's the reason why dementia prevention could be a very important piece. And if we can start it early, better it is. So I'm going to, in next few slides, I'm going to talk about some facts of dementia. So why Finland has the highest rate of dementia? So we know that Finland, according to research, has the highest rate of Alzheimer's dementia, 54.65 cases per 100,000 people. UK has 42.70 for every 100,000 people, and USA has 33.78 cases per 100,000 people. When we see a large number, for example, not rate, but number of cases of dementia, highest in China. And the diagnosis usually starts at a very young age. But the fact is why Finland has the highest rate of dementia. In Finland, environmental factor plays a very important role. They have found out there's a deficiency in a tracer element called selenium that could be responsible for memory loss. But the most important thing is they also have found out the water has mercury in the water, which reduces the glutathione ability to protect neurotoxins, and mold growing in homes also is neurotoxin. So what does this neurotoxin does? It causes degeneration of the nerve, and in return, dementia can happen. The second country I found was very interesting, and it was in the research in articles I would go, is Bolivian Amazon, which is in Central America, South America, sorry. And I think it's below on the west coast next to Peru. People there, only 1% suffers from dementia. And the reason is they don't do processed food. They walk and they hunt for food. They walk 12.4 miles average over 8 hours period. They don't sit for 12 hours, in their doing desk jobs. And above all, they live in communities. They are not isolated. So these two, the Finland, which has the highest rate of dementia, and when you see Bolivian Amazon, which has the lowest rate of dementia, we can see some factors here that are modifiable, or we can change those factors. For example, we can limit our processed food, we can limit our pollution, we can, try to eat more, drink more healthy water, more physical exercise. We can see that it can be preventable. And so I think today's topic is very important to know that dementia prevention should be in our list, foremost list, especially, for not when we are at 65, 70, 80, but we should start as early as possible. This is kind of a statistics which says, America has, the expectation of by 2050, it can be 29.9 and Africa 15.8, whereas European countries 18.6. This is the worldwide dementia, numbers that we can see here is expected to rise. So in medical terms, we define dementia as basically generalized brain degeneration. So when there is a generalized brain degeneration, the brain actually shrinks. And what happens during this process or the pathology is the plaques and tangles. In normal terms, it's plaques and tangles that forms in Alzheimer's brain, which is not present in a healthy brain. And can we get rid of those? Yes, there are, for example, we'll talk about it in details later also, but good sleep can take away these plaques from your brain. So it basically washes those plaques away, which is a debris for your brain. So going to the next slide. I just talked about what is the difference between normal aging and dementia, and which is very important to know the difference. And the most important thing that I always want to bring in this slide is normal aging is not dementia. A little bit of forgetfulness is possible, but it does not disrupt your daily activities. When we do a diagnosis of dementia, or when we come to a diagnosis of dementia, the most important thing that we rely on is the history. Dementia, like I said, is a term and a cluster of term together, like Alzheimer's dementia, vascular dementia, Lewy body dementia, frontal lobe dementia, all together. I'm using the term dementia here. So if somebody comes in with forgetfulness or memory loss, first we should keep in mind whether it's a normal aging or is it dementia. If it is dementia, what it could be, and what else we can help this patient with. Dementia is a diagnosis of exclusion. So we do blood work here. We look for cholesterol, we look for cholesterol, we look for diabetes, because those are some of the risk factors for dementia. But we also look for vitamin deficiency, B12, folate, thiamine. We do blood test, we do CT scan, MRI. But the most important forefront is taking a very good history, where we usually do a mini mental status exam or a slump test for somebody who's more than 85. And along with that examination, if somebody is sitting in front of me and says, yesterday night my right leg was, I could not move my right leg, and then I realized I had a slurred speech and I'm forgetting, that's could be abrupt onset, could be a vascular dementia, patient had a stroke. So keeping in mind history is the most important factor here. We do blood work, we do CT scan or MRI to exclude, but with time, more investigation and diagnostic tests are coming, which I would show in some of the slides here. One test, that blood biomarker, I love to show these slides, but this test, I don't think any physician orders this test unless asked. For number one, it's very expensive test, and number two, it's still in research. So we don't do this test. Most important thing that I would still say, taking a good clinical history is very important in diagnosing a condition of dementia and what kind of dementia it is. We always order an MRI brain just to make sure there's not a lesion in the brain, there is no stroke or blood circulation affected in the brain. And in dementia, especially Alzheimer's dementia or even Lewy body dementia, you'll always see some atrophy in the brain. The hippocampal atrophy attributes to either Alzheimer's or Lewy body dementia. Frontal lobe dementia, there would be some other area in the brain that would show atrophy. And the ventricles would be enlarged. So those are the few things that clinicians look into to see what could be causing this dementia. A PET scan is another test that we do, and it tries to find out the hypometabolism in the brain, which causes neurodegenerative disorders or degeneration of the nerves in the brain. So these are some of the tests very commonly. MRI is very commonly used when we want to diagnose MRI after the clinical history suggests you that it could be dementia. I'm not going to go in details into this slide, but just to say which dementia is the highest among all the dementia. Alzheimer's dementia, 70% of all dementia, 50 to 70%, I would say. Vascular dementia is, and Lewy body is second. And the last is frontotemporal lobe dementia, and some of the famous personality, which we know Bruce Willis recently, came up in the news with frontotemporal lobe dementia. Robin Williams had Lewy body dementia, and some of, I would not go in details on this slide, but as we go, we'll talk about some of the dementias. But today's slide, when I talk about in next few slides, would be more mainly discussing about Alzheimer's dementia, because that's the highest in number. So as a physician, when we see Alzheimer's dementia, like I said, clinical history is very important. If it is Alzheimer's dementia, there would be memory loss. There would be, not being able to do his daily activities. And it happens slowly over time. If it is vascular dementia, it can happen very abruptly. Blood pressure was high, patient has diabetes, high cholesterol, got up in the morning, is forgetful. Frontal lobe dementia would be more like, he's a lawyer, has trouble organizing things. A wife recently thought maybe having depression, went to a psychiatrist, gave depression medicine, but he's not improving. Over time, he's more disorganized, making inappropriate comments to his wife's friends, is not aware of his emotions or others' emotions. So those are more frontotemporal lobe dementia. Lewy body dementia is very fluctuating in attentions. It is, maybe a little around 60, 65. Along with it, could have constipation, have a little Parkinson's-like disease also possible, may have a family history of Parkinson's disease along with it. Next few slides, I'll be talking mainly about Alzheimer's dementia because that's more prevalent. Alzheimer's dementia facts: 1 in 9 people age 65 and older has Alzheimer's dementia. Two-thirds of women can have, two-thirds of the Alzheimer's dementia are women. Between 2000 and 2019, death from stroke, heart disease, and HIV has decreased, whereas death from Alzheimer's dementia has increased more than 145%. So there is an acute shortage of neurologists. They're calling it dementia neurologist deserts. And, by 2025, they're expecting much more shortage of neurologists. So as primary care physician, we are the forefront to diagnose dementia, help people to prevent dementia. There are some preventable risk factors that we can start early to prevent dementia. Alzheimer's dementia facts on women. Women are twice as likely to be diagnosed with dementia than men. Women often diagnosed later and have a faster decline. Leading cause of death and disability for women could be dementia. Women do not, most of the time, they take care of themselves, but, do not take care of themselves most of the time. And women do most care for people with dementia. So in a household, if somebody has dementia, most of the time is the women in the household taking care of the demented person more than the men. As physicians, something, since we are talking about prevention, I'm not going to talk too much on this slide, but when we talk about dementia, we not only see the cognitive decline and how to take care of it, we also look into the psychiatric aspect, behavioral change, household changes, any physical decline happen or not. But the most important goal that we have to take care of is to preserve dignity in that person, whether it's stage 1 or in stage 2 or stage 3. What else we can do to make this person feel dignified, or even if they don't have a memory, the family members should feel dignified. So this should be the goal or aim for all of us while taking care of a demented patient. Facts and figures of Alzheimer's dementia in USA, currently 6 million. Actually, this is, I took it out from 2023 census. So the last sentence is $345 billion has been expended on dementia, out of which actually half of them is caretaking, which is family member caretaking time. So 1 in 3 seniors dies with Alzheimer's dementia, and Alzheimer's kills more than breast cancer and prostate cancer combined. Cause of dementia, Alzheimer's dementia, if you see the lavender color, which says sporadic or unknown, that is the most importantly, the cause sometimes is not known. There are sort of genetic and other factors related to it, but it's mostly sporadic or unknown family history. Alzheimer's dementia, early onset, which can start even at age 30, 40, or 50, they have found out few genes which has a mutation defect in those genes. One is amyloid beta precursor protein, other is presenile 1, presenile 2. But this early onset gene is present only in 1 to 2% of Alzheimer's dementia. Out of overall Alzheimer's dementia, only 1 to 2% patient may have early onset dementia. So these tests are not run in clinic. And, if somebody has early dementia and the family, the second generation family also has it, that's something you can think about doing. Late onset Alzheimer's dementia. There are, ApoE lipoprotein gene, E4, which can increase the risk. the word is risk, is not a mutation in the gene. Increase the risk of Alzheimer's dementia. And one famous Australian actor, as you can see it, had both these types of, like, from the mother and the father. He has received the apolipoprotein E4. So this particular apolipoprotein E4 increases his chance 8 times, 8 to 10 times more likely to develop Alzheimer's dementia. So, in clinic, a lot of time my patient would come and ask, can I get this test done? And we can run that test, yes, but number one, is expensive, but number two, it is not a test that tells you that if this ApoE4 comes, as homozygous or heterozygous, that you will get it. But there's a risk. This gene is a risk gene, not a mutation. So there's a chance that if you have this, you may get it. Alzheimer's dementia, please remember, there is no drug that can take the brain back to normal. And there is no survivor for dementia. In breast cancer, we can say he's a survivor of breast cancer. In dementia, ultimate can be death. But yes, we can prevent it. Yes, we can give a good quality life while they have dementia. So my topic to talk today is prevention. So current science indicates individual can reduce the risk of cognitive decline, dementia, Alzheimer's up to 70%. And 40% of all dementia in your community can be prevented. So in short, if I have to write quickly, I would say eat well, get moving, stay sharp, be social, sleep enough, address current, reduce stress, hear well, and avoid bad medicines. So any risk factors that is contributing to dementia, and if they are modifiable risk factors, and if we can take care of them early, yes, we can prevent having dementia or having dementia long later in life. So this was a very nice article that I found, 12 modalities risk factors. And if you see the one in green here, it's like early life, less than 45, early education. So it's people who are more educated or have a degree has less likely of getting dementia than people who are not enough educated. So before 45, try to get your degrees, read more. Then this is one of the preventable risk factors. The second one was midlife, where comes hearing loss, hypertension, maybe an accident or traumatic brain injury, obesity, alcohol. We can even add obesity here, and diabetes. Then the purple is later life, like maybe after later life, more than 65. Diabetes can be preventable. If we can take care of diabetes well, depression well, air pollution, social isolation, not being alone all the time, making good social connection, stop smoking, paying a lot of attention on physical activity. Yes, these risk factors are preventable. And overall, sleep and diet is important. Next slide. So when we talk about preventable, and these three things comes in mind very often, because as physician we see this almost on every clinic patients. So if we can make sure, tell patients that hypertension is a risk factors for dementia, and what is how much. So population attribution, risk factors for hypertension for dementia is 15.8%. So it is very important to manage the blood pressure to reduce this dementia. Hypertension what does this actually hypertension cause is vascular oxidative stress, which causes neurons to degenerate because they do not get enough oxygen or blood circulations, and is responsible for the dementia. Diabetes, a patient with diabetes will have twice more chance of having dementia than one who does not have diabetes. And to add, even pre-diabetes is also is a risk factors for dementia. And coming to cholesterol, 27% more chance of having dementia if somebody has high cholesterol. And the other article was a very high good cholesterol above 80 is also linked to dementia. As a physician, when I see my patient, I put them into these three categories all the time, and it comes in my mind. Does this patient has any environmental or demographic problem? Like how much he's educated, does he live in a, how is the pollution in the house? Or does that person, he or she lives alone? Those are some of the factors I'll keep in mind. Lifestyle and habit and diet, smoking, alcohol, how much food, like what kind of diet he's taking. Lifestyle and habit and diet plays a big role here. And I think most of us, even not going to a doctor, can take care of this by ourselves. And what things as a physician I can do? Can I help this patient with lowering the cholesterol, taking care of the depression, helping getting the diabetes under control? You know, so some of the, factors that we see here are modifiable risk factors, which means we can reduce the chance of having Alzheimer's dementia by taking care of this. So again, comes prevention, lifestyle change, mindfulness technique to reduce anxiety and depression. Does supplements play a role? Does the new gadgets or new things or can come up in the market has anything to do to prevent Alzheimer's dementia? So first thing that I would like to talk about is eat well. So eating well, actually the research that I was doing, it's to prevent Alzheimer's dementia, the diet they called is mine, is Mediterranean and DASH diet together. And the easy way to remember is when I have my food, I'll always remember to eat a cup of green vegetables, a cup of dense vegetables, which could be carrot, eggplants, those are dense vegetables. And then at least, a cup of berries, if not every day, at least 3-4 times in a week. They are saying twice per week. Having a handful of nuts, whole grains, eat fish if you can, at least once. Eat lots of eat lots of chicken, fish. Cut down on red meat. Wine, the question always comes, how much of wine? So after 65, 1 glass of wine, 5 to 6 times in a week. If you're doing more than that, I would say cut it down and, should be 5 to 6 times. And other than wines, which red wine would be the favorite thing, would be the way, red wine would be expected to take, but other wines does that like beer or scotch. No research has been done that, you should be taking it, how much you should be taking it. But please limit your alcohol as much as possible. Move more. Sitting 12 hours per day increases risk of dementia by 63%. If I have to give one slide to everybody today here, it would be this slide. Because moving, exercise, physical activity is what prevents dementia more than anything else. If you don't have any health condition like hypertension or diabetes or high cholesterol. So anybody can start from any age, even a teenager, continue doing it. Discipline is your destiny. So please exercise every day and take care of your health. So this is the most important slide out of all the slides here, I would say. What exercise does? Exercise works as a fertilizer for the brain cell. Brain-derived neurotrophic growth factors is produced when we exercise. And what does this BDNF does? It protects the existing brain cell from getting degenerated, and it helps to create new brain cells actually. So how much exercise is just enough? Just enough. The recommendation is 150 minutes of moderate cardiovascular activity weekly. So which can be 30 minutes per day for 5 days in a week, and add to it 2 weekly strength training sessions. This is just minimal. We should, at least all of us, do this. Example of moderate activities are brisk walking, mopping floor, even playing tennis or badminton could be under moderate activity exercises. And vigorous activity if you're doing, and the research has found out, if somebody is a player or, plays on a regular basis basketball and does vigorous activities, it can reduce the chance of having Alzheimer's dementia by 29 to 40%. And vigorous activity can be 3 or more times per week. Taking care of mental health is very important. Depression increasing the risk of dementia by 14%. And what happens when we are depressed? When we are depressed, our glucocorticoid increases. There is reduction in the BDNF, which is liberated when we exercise, but in depression, it reduces. Along with it, 5-HT, which is 5-hydroxytryptamine, also reduces in depression. And depression also reduces the chronic inflammation markers. Increases the chronic inflammatory markers when we are depressed. Interleukin, alpha, beta, 6, TNF, those increases. So there's inflammation in the brain in a normal way, if I have to say that. Increase steroids. All this leads to increasing the alpha beta toxicity, which causes hippocampal atrophy. So the plaques, you are giving more chance for the plaques to increase in your brain. This was a very important topic, and I had to go back and read again and again because it was so interesting that regular dental visit is important. And science has found out this species of bacteria, which is called Porphyromonas gingivalis, can move from mouth to the brain. Once in the brain, the bacteria releases enzymes called gingiapines that can destroy nerve cells, which in turn can lead to memory loss and early Alzheimer's. And there was another interesting question that has come up in research is people who does more nose speaking has more chances of having dementia at an early age than people who don't do nose speaking, because the olfactory cells, a change in microbiomes happens and they travel to the, when we nose speak, and it travels to the brain, and that can cause degeneration of the brain cells. Okay. This one is hearing. This is the most easy modifiable risk factors, because if you have a hearing problem, get your hearing checked. And, once you wear your hearing aids, your dementia or cognition can improve. So this should be easy to take care of. Sleep well. Sleep well. People who sleep less than 5 hours per night has twice as likely chance of developing dementia. Some medicine to avoid. So, I found out the list of medicine, but while, doing it on the blue that you see here, I wrote down those medicine because I feel like these are very commonly you see in your chart when we see patients. One is alprazolam, the other is Benadryl. People a lot of time take Tylenol PM, which has Vistaril or Benadryl to help you to sleep. But is it helpful in the long run? No, because it increases your risk of dementia. Taking gabapentin, Lyrica, or Vesicare to take care of the bladder, that can increase, those are anticholinergic load, can increase your chance of risk for dementia. Pain medicine like oxycodone, Lunesta, Ambien, Elavil. Elavil, we don't see it very often now, old medicine, but we still see in some charts that it's there, because this is also which increases the anticholinergic load in the brain. So a list of medicine. You can go to a website also, I can share the link, should be in your refrigerator, that as after 60, I would not be taking these medicines. Okay. Sharpen your brain. That is also preventable. The more sharpened we make our brain by ourselves, the less chance of having dementia in the long run. So a few things like playing jigsaw puzzles, or playing Sudoku, or playing chess, learning a new musical instrument, or learning a new language. All this can help to sharpen our brain. So basically tasking our brain to learn new things. More tasks is given, like learning a new language may be more difficult than playing chess or puzzle. You're taking care of the risk factors for dementia. So there are a few games or, apps that has come up in the market. One is CogniFit. And I think it's pretty cool. When I went to see this, the brain training is really good, and there is a lot of cognitive testing that you can do, and you can improve every day. So I think they say to spend 20 minutes 3 times per week on this. The app is available in any app store. So the other thing is cognitive rehab therapy, which is done for brain injury patients, but now they're saying it could be very helpful for Alzheimer's dementia. So there are special trained people who can do this, like occupational therapists. And so it basically takes care of the emotions, behavior, physical sensation, thoughts, and it's not a one day, but it's an ongoing cognitive behavior therapy, which can be helpful for patients to reduce the risk of dementia. This is a very favorite topic, especially after COVID. And let me share this story. I was in my clinic and one of my staff told Dr. B, this patient of yours, who actually comes to see me here also, said that during COVID time, when we all were locked in our houses, she had nobody to talk to and she was talking with her cats and dogs. And when I picked up the phone and asked her how many days this is going on, she said, I did not talk even with my daughter for last 15 days. So, I would say I have not even talked with anybody for last, my daughter called me one time 15 days back. So last few months, I have not talked with anybody. So this was, during COVID time is when we all felt lonely, and especially with seniors. So the risk of dementia, in maybe a few years down the road, we'll see more because we had COVID in those years. So interactions is very important. And if I have to say social connection, I usually, divide it into 3 tiers. You should have 3 tiers of social connection. One tier is you should have one, two, or few people whom you are very close to. You can call them even at 12, or you can pick up the phone and talk with them. You should have at least one or two people like that. Second would be, coming to work and talking with my colleagues or with my friends. I'm going with my friends to, restaurants or playing pickleball. And third tier should be, which is also very important. A lot of times seniors don't have friends, don't have any close people. Is, when you go out on the street, if you're sitting in a park, if you see somebody is walking by, smile and say, how are you doing? Or, I like your dog or something, just begin a conversation. So these 3 kind of social connection may help you to prevent the risk for dementia. This NICE guideline is recommended for, the reason I put it here, this is not part of the prevention, but I felt like I should put it here because this NICE guideline has very nice guidelines for how how caregivers or any one of us can learn to help somebody who has dementia, early dementia or moderate or severe dementia, mainly moderate and severe, learn how to, take care of emails. They have come up with few apps and cell phones, how like, if you forget the name of the person, but maybe the picture you can remember and, click on the picture and call that person, talk, how to cook meals without getting any hazards, fire hazards, or, what else you can do to participate in activities on a regular basis. So this is something, when I read that 47 page was very interesting. And if we all of us have some knowledge about it, we may be able to help others who have dementia. This is a free handbook, which is available in the Alzheimer's Society. And actually I got it from UK, but it's also like a few 60 pages and has a lot of information about activities and, board games and other things. The question I may get on, from you all or anybody, I get from patients most of the time, statin and dementia. Should I take statin? Because it will increase my chance of having dementia. Statin in 2016 research, there was an article which says that, cholesterol lowering drug can increase dementia. But after that, research has been done. In 2018, American Heart Association had mentioned that there is no convincing evidence for a relationship of statin with dementia. If I ask a cardiologist, they would not even listen to me. They would say, no, if my patient has to be on this statin. So what I usually do with my patient is if somebody has diabetes and very reluctant to take statin, I would say, how about we give you a little dose of statin on Monday and Thursday and see how you're doing. And I would explain them, the facts. So, I would usually put patients on statin to a dose they can tolerate, is how I do it. But I would not say no to statin. Okay, summing up. So exercise is first in my list to prevent the risk for dementia. Second comes eating right. The diet is MIND, M-I-N-D, MIND diet. And it's basically a combination of Mediterranean and DASH diet together. Then sleeping well, taking good dental care, social connection, and look into the Cognitive app, which is very helpful. Does supplements play a role? The new research, with all the research papers that I was seeing, one thing that came up is Serinovex, which I just learned, is probiotic strain. They're claiming, the research is claiming is helping with to prevent dementia or helping the improving the cognition of the brain. And is it possible, like gut health, we have dysbiosis, we may have brain dysbiosis, which needs to be investigated further, or more research needed to be done. Second is selenium, which I did not know all these years, but with research I thought, okay, I'll add selenium here. Magnesium do have some role. Thiamine, other vitamin B12, nuts, and other Mediterranean diets, maybe they have more tracer elements. And the other thing, I forgot to mention here is getting rid of heavy metals. So usually I add a heavy metal blood test or urine test on my patients when I'm trying to diagnose them for dementia. Gadgets. Virtual reality for people living with dementia. There are gadgets available, but there are also gadgets available for train the cognitive ability of brain. Is also available now, and ongoing research is going on that is helping to improve mobility, to prevent fall, even train the cognitive ability of our brain. I wrote for dementia, but even without dementia. Stem cell therapy. This is not approved by FDA yet, but stem cell therapy has shown some good results with dementia, and it does research has seen that it is enhancing memory function, new nerve cell regeneration, and overall recovery and improvement in dementia. I would do it on my patient. No, I don't have access to it, but stem cell therapy, a lot of research has come up in the market that it is helping with, and a lot of physicians are using it for improving mental health. Questions?
Okay, looks like we've got a few questions. One is, my son has frontal lobe damage from a head-on collision. Took months for him to recover. What are the chances of him having dementia?
Very good question. He is a risk factor. He's a risk factor for having dementia because, when I was showing the slide, brain damage, it has a risk factors for dementia. But, I would do cognitive therapy, or it is done by occupational therapist. If you don't have access to it, there is 1 or 2 centers in Richmond doing it. I can forward it to you or to Stephanie. The number and address. They do a great job, and having training for that cognitive rehab is very important if somebody had brain injury. But the percentage, I don't know, but yes, he's a high risk factors for it. But it can be modified, yes, with the physical therapy that I'm talking about.
Okay.
Thank you.
Another person asked, will these slides be available? And yes, we actually record all of these series that we do on Zoom, and they should be up on the website next week in our blog section, and we'll probably send out an email as well so that you can look at that. And one other note, somebody mentioned that on Fox News just this morning, they saw Dr. Ornish give a presentation similar to what you're talking about. And she says, are you familiar with the research done by Dr. Ornish? His website is ornish.com, and he promotes a healthy plant-based diet, moderate exercise, reduced stress, and interaction with communities. So that's somebody, I don't know. I have not personally heard of him. I don't know if you have, but that's just a note that one of our viewers had.
Yes, so I'm aware of the Ornish diet. It's a plant-based diet. Only thing that you know, I don't think there's a research done over 14 or 15 years to see that patients who are on his diet is improving. But only thing that I would add is fish, or adding supplements of fish oil to that diet. But yes, I'm aware of that diet. He does a plant-based diet he writes down the exercises you should be doing, how much jumping jacks you should do. Everything's written down. It's more moderate exercise. And he is following the one, that I was talking about here.
And what type of fish would you recommend? Is it the white fish or?
The wild caught salmon, anything that has more fat to it.
Okay. We have another question. Can tinnitus become a factor contributing to dementia?
There are several causes for tinnitus. If the tinnitus is related to central brain damage or central brain tumor, it can be a risk factors. But tinnitus can also happen with I had one patient with dehydration had tinnitus, or taking aspirin causing tinnitus. Those would not cause it. But if it is related to brain, yes, it can be a risk factor.
Okay. It looks like that is it for the questions. You told us a lot of great information. I so appreciate you taking the time to spend with us today. I know you're super busy, but this was really great information. So thank you for joining us.
Thank you.
You are the last of this current series, but we're looking to do more in the future because we just love working with CenterWell. And so thank you everybody for joining us. Thank you again, Dr. Banerjee. Look forward to seeing you.
Thank you.
And everybody have a wonderful weekend. Take care.